the growth since cases started increasing. This is the growth of the Delta variant. As you will see, it is faster and steeper than anything that we have seen to date, and it does not look like it is slowing down. Let's go back to the last chart. Just look at how quickly we have gotten here. The slope of that line, the increase, folks, if we go all the way back to the beginning, that's Philadelphia. That is exponential growth that continues to put the lives of Kentuckians in significant danger. And we'll show you some of those numbers in a minute. Positivity rate is at its highest rate since we have had the true ability to calculate a positivity rate. In other words, since we have had enough testing to get an accurate one. So here we are at a time when we have vaccines, when we know that masks work, with our third highest week of cases ever and the highest positivity. That means COVID is burning through our population here in Kentucky. Then if you look at the severity of the increase in positivity, again, you could see that the Delta variant spreads faster than anything we have ever seen before. And today, we're reporting that we have a record number of Kentuckians hospitalized for COVID, a record number of Kentuckians in the ICU battling COVID, and a record number of Kentuckians on a ventilator trying to survive COVID. All three in one day. Let's look at our ICU inpatient census. So as you could tell by that line graph, we're at the highest point we've ever seen, 1,893 Kentuckians in our hospitals, meaning they are sick enough to where they need hospitalization. Not monitoring, but an actual staffed hospital bed. And again, look at the slope of that line. We got here so much quicker than anything we saw before in the pandemic, which means that number is only going to continue to increase. Our hospitalizations have been doubling just about every 2 weeks. And folks, that means we are getting really close to every single bed across the entire Commonwealth that we can staff being full. And we're going to have some people talk to that in a minute. There are some hospitals in some areas that are already at critical, out of space, and now spend more time calling other places to see if there's a bed than they ever thought was possible. Let's look at the ICU census. It's up 23 Kentuckians just from yesterday. 529 Kentuckians currently in an intensive care unit where we have a much more limited number of beds, again, fighting for their lives. And then there are COVID-19 patients on a ventilator, 301 Kentuckians currently on a ventilator at this point, just trying to survive. Again, this is one day where we have a record number of all three of those categories. And again, you can see by each line, it's only increasing. So what does that mean for our hospitals? We have between 21 and 25 of our regional hospitals that are at a critical staffing shortage stage. Many more, up to 11, are having nursing shortages at this point that limit the number of beds that they can ultimately take care of people in. Hospitals specifically concerned about child care for hospital staff if schools end up closing because of a large amount of students in quarantine. In other words, they're not just worried about keeping enough people on the job. They're not just worried about their folks getting COVID because we've lost EMS and EMT units that we desperately need right now, full shifts because of COVID, but they're also worried about the rising number of cases in schools because think about one region, what that means, how many people might have to stay home. Hospitals are converting space into ICU overflow. They're discontinuing overnight surgeries, and they are implementing, I want you to hear this term, modified disaster mode, except for at least one hospital that is in full-fledged disaster mode. Pikeville Medical Center is one example that's set up triage tents outside the emergency department to manage increased patient visits, knowing that their emergency department is overrun, and this giving an opportunity to see some people who don't need to be there and move them out. Let me remind you, If you just need a COVID test, even if you're symptomatic, do not go to the ER. Going there could take away needed time from those that are in an actual emergency. So please, please bear that in mind. A couple of other pieces. Baptist Health Hardin, E-Town, full ICU, and they're converting same-day surgery into ICU overflow. Jenny Stewart Medical Center is working to set up some new infusion sites. They're seeing so many people that need those monoclonal antibodies. St. Elizabeth Healthcare also looking at the same. Owensboro Health in Twin Lake having to, in Litchfield, is reporting to being in a modified disaster mode due to increased COVID related emergency visits, either seeking treatment or tests. This is real. It's all over the Commonwealth. But I want you to hear from perhaps the hospital that we've heard from once before. It's maybe hit the very hardest, the earliest, but one that we think that we will see more of. Today, live, at least by video, we've got Lorraine Wilson, DNP, RN, and William Milan, doctor, who will be in the same office to discuss the current situation at St. Clair and Moorhead, which has gotten even worse.
Good afternoon, Governor. And I wanted to just give you a brief overview and everybody across the Commonwealth of our current situation. I have to say our inpatient census by day of COVID patients looks just like the graphs that you shared. We have doubled in 1 week, unfortunately, however. We've gone from 17 to 32 in the last week. And our curve appears to be getting sharper. We have, over the last 6 days, had to open an overflow intensive care unit in our post-anesthesia care unit, which has affected our ability to perform important surgery. We also have been opening more and more COVID inpatient units by basically taking from our regular units and creating them into isolation wards. We've made the very difficult decision to move to Code Yellow, which is our disaster plan, which became necessary acutely because of the slope of increase, and also because we have a very critical nursing staff shortage. We have three divisions or sections in our incident management team. We have a clinical operations section, a logistics section, and a human resources section / task force. Human resources, especially professional staff, is, if I could restate that, critical right now. We are still short on staff for tonight, in fact. We are able to currently pull this off because of an incredibly dedicated home health team that is managing an additional 32 patients at home who, under ordinary circumstances, would be inpatients also. So they have basically kept us from tipping over. I'm going to give Lorraine just a moment to tell you how many nurses we're short.
We currently are staffed for an average in-house census of about 70 to 75. We've been running close to 90 to over 100. As of this morning, we had 106 patients on the in-house side. So that's on the board. We're posting about 25 RN vacancies. It's just a nightmare to try to staff these med-surg units. And it's not just COVID patients that we have in the hospital right now either. It's a lot of med-surg, a lot of tele, a lot of critically ill patients. So when you throw COVID patients in on top of that, it makes it doubly hard to staff.
What is historical is we currently have more critical patients than beds. So we're in a temporary overflow intensive care unit, or we wouldn't be able to do it. And fully, if you look at our census, over half of our inpatient care right now is dedicated to COVID. So that's our situation.
Can you all hear me?
Yes, sir.
Well, first, let me say how much we all appreciate your work in the most terrible, I know, of situations, and what must seem dire, and the trauma that you all endure as well. And we so incredibly appreciate the bravery and the resiliency that y'all are showing. A little bit later, we're going to be talking about how we're going to use National Guard to provide some assistance, and that we've specifically requested FEMA help for St. Clair. So we will continue doing everything we can, but we love y'all. And thank you for caring for those that need the help. Can you talk a little bit about what you see vaccinated versus unvaccinated?
Yeah, these are victims of non-vaccination. There's no doubt about that. We are doing a tracking of that situation because of actually the very effective state immunization registry. And my estimate is between 10 and 15% of our inpatients are vaccinated. 85% are not vaccinated. The vaccinated ones are not as sick as the unvaccinated ones. I believe our entire critical population is unvaccinated.
So how can the people of Kentucky help y'all? How do we push through this without y'all having to see so many sick people?
There's two reasons to be vaccinated. A lot of people think there's one, but there's two. One is to protect you. The other is to protect the people around you. Let me just point out a little bit of reality here. If we had another disaster happen now, even a small one, we don't have any reserve left. So if we had a bus accident, or if we had some other issue, or we had an influenza outbreak or whatever, not sure what we would do. So vaccination is clearly what is going to get us out of this. It is FDA approved, and it is safe, and 100% of our medical staff is vaccinated.
Thank you all so much for your leadership. Again, we hope the whole community also rallies around to show their support, and thank Don behind you for his great leadership. Thank you so much for joining us. All right. Unfortunately, St. Clair is not the only facility that has hit this hard, but can't you see and can't you feel where they are? We also have today Steve Haynes, the Nursing Director of Critical Care Services at Ephraim Mcdowell Regional Medical Center in Danville. He's on via video, but you're going to hear a lot of the same things.
Haynes, I'm a nurse here at Ephraim Mcdowell Regional Medical Center in Danville, Kentucky. I am the Nursing Director of the Intensive Care Unit and the Cardiovascular Step-Down Unit. I'm also a respiratory therapist, and I've been here for 7 years. This latest surge we're going through in the pandemic, it's been pretty horrific. Last time, in the early surges of last winter, it kind of came on gradually. We got a lot of preparation and stories from friends that had worked in New York City, and you could see the virus coming across the country towards us, so we had time to be ready for it. This time, it was like the door opened and it just kicked it in. We were immediately overwhelmed. This last week, or actually last 2 weeks, has been, as I said, it's been pretty horrible with the way it's just come on. And unfortunately, people are passing away from this quickly. Over the weekend, we lost 8 patients within 24 hours. We only have like a 3-bed morgue at the hospital. So we actually overwhelmed what we have, and we were kind of frantically scrambling to try to rent a refrigerator truck to take care of these people. The funeral homes couldn't pick them up fast enough. And 95% of the people we're intubating have no vaccine. And some of these people look so disappointed or so angry. Just a whole sequela of emotions that come out of them. But they're scared and they're trying to mask what's going on because they just can't breathe. We put on their families on FaceTime. We let them have maybe their last conversation with their family member, and we put them on a ventilator. It's horrible because we'll start fixing somebody's lungs and then they'll get attacked by clots and they'll clot off every single artery in their body and then they'll pass away that way. Or we have tons of strokes and and then lots of pneumothoraxes. It's a horrible disease. We'll take somebody out, we'll take them to the morgue that we just can't save them, and there's somebody waiting 2 minutes later. And we get the housekeeping comes in, cleans the room, and we're putting somebody else in there, and it's a horrible rinse and repeat cycle. This lasts as long as the last surge that was 3 months, and we're only 3 or 4 weeks into this right now in my community. I don't know. I mean, we're going to do it, but it's going to take a monumental effort because it doesn't matter how many nurses or therapists or physicians or pharmacists or anything else we have. It's just not going to be enough. I really think we wouldn't have to work so hard to help our community if more people were vaccinated. And right now, it just looks like there's no end. And I think the only chance we have is vaccination. And that's it.
I want to thank him for his courage, for not only what he does every day, but willing to be that raw and authentic to show the trauma that they're going through. We think a lot, and we should, about that individual that we lose. We don't think a whole lot about the trauma of watching those people pass away. And just some of the things he said, they've overwhelmed their morgue. Funeral homes can't pick the people who've passed on away fast enough. They take someone down to the morgue and they have to fill their room in the next 2 minutes. Well, it's a powerful message to get vaccinated. It also shows you what these healthcare heroes are going through, and they need our support. They deserve our support. One more video we've got on what we're seeing. We want to show you some different communities. This is Dr. Jason Smith, Chief Medical Officer of U of L, who's sharing his message via video on where the hospital capacity currently stands and what it'll take for us to turn the surge around.
I'm Dr. Jason Smith from U of L Health. Right now, we're in the midst of the 4th wave of this pandemic, and it is vitally important that people go out and get a vaccine in order to try and stop this. Over the past 3 weeks, we've seen the numbers in our healthcare organization quadruple regarding the number of patients we're seeing. We're seeing younger patients that are sicker. They're filling up our hospital beds. They're backing up patients in the emergency departments. And we're getting to the point within the city itself where we're going to be having a difficult time delivering emergency care to those that need it. So I urge everyone within Louisville and within the Commonwealth itself, please step up and get the vaccine for yourself, for your family, and for the communities around you, but also for those that need our care when we may not be able to provide it.
So again, that's Dr. Jason Smith, heading U of L Hospital's efforts. He was our first Kentuckian vaccinated. Numbers that he's seeing have quadrupled. People who are coming in are younger and sicker. And the city of Louisville, with probably the most healthcare capacity of anywhere in the state, or at least in the top 2, it's going to have a difficult time providing emergency services. They also mentioned how they're seeing more younger patients. We are continuing to see the portion of cases we have on any given day skew younger and younger. Can you show the pie charts? This is to give you an idea between last year and this year, what portion that kids under 18 make up of all the cases we're seeing. Remember, we have a ton more cases this August of 2021 than we did in August of 2020. I think we're already more than double what we had at this time last year in cases, significantly more in kids, but basically they're now taking up twice the amount of cases. And remember, we don't test a lot of kids either. The highest incident rate is in between people 10 to 19 years old every single day. And folks, that's hitting our school systems. We saw, I think it was Leslie County today, that had to cancel or push back classes. That is now the fourth or fifth county that we have seen. And remember, we're doing this fight with right now having the Kentucky Department of Education's regulation on masking in public schools in effect. But I will, again, want to make sure that we know what happens when we don't mask in schools, regardless of whose decision it is to make. We fail when we don't require universal masking. We saw that in the Warren County Public School District when 3 days of optional masking led to 700 quarantine individuals. It's even higher now, but this one really hit me. This is in West Texas, and I was watching this morning. They have an entire school system under quarantine. Every single person in the school system, it spread so fast. This is a school system where they weren't masking or didn't require it. In West Texas, an entire school system. And you know what? They're going back with masks when they can. That this was for them, they talked about a political issue until guess what? It hit everybody. And everybody, almost everybody in the entire town, but certainly everybody in that school system is now at home for that period of time. So many people not being able to go to work. I mean, life halting. This is a shutdown. It's just COVID did it instead of anybody else. So let's just remember what happens. I mean, we know how quickly the Delta variant spreads, especially among unvaccinated individuals. You put a whole class of kids that can't be vaccinated or who aren't vaccinated together. This is the only outcome that you're going to get. It's not magic. Hand sanitizer won't stop it. This is what happens. So as we move forward, please, let's make the right decisions, whether they're the school systems or the private schools to make or a board of education. Let's please do the right thing. We see every day what happens when we make the bad decision. Let's make the good decision. I haven't given a specific day report at one of these in a while, but today, even this far into the pandemic, is the highest Monday that we have ever reported in terms of cases. 2,596 cases. Again, most Kentuckians ever hospitalized in the ICU and on a ventilator today. Mondays are usually our lowest days, and this is the highest Monday that we've ever had. And I want to give you an idea of how and who makes up these cases. The incident rate for the most vaccinated individuals, which are 80 and older, is 40 today. 40 is not something we want, but let me give you the contrast. The incident rate from 10 to 19-year-olds is 108, right? That's about 2.5 times more individuals, 10 to 19. Current positivity rate, 12.87% today, and 17 deaths. It's been a while in a single day since we have seen that. And virtually all these deaths are in August. Every single one of them. So this is right now caused by the variant. 7 of them are people under 60. That include a 30-year-old woman from Jefferson County, 37-year-old man from Martin County, 43-year-old woman from Pulaski, a 56-year-old woman from Fayette, a 59-year-old man from Crittenden. But you know, when we lose people to COVID, it shouldn't matter their age. I mean, there's a 103-year-old woman from Warren County here. That means she beat so many other things. And if we'd all gotten vaccinated and thus the Delta variant couldn't be here, she'd still be here. So let's continue to do the right things. So with the Delta variant burning through our population, with hospitals bursting at the seams, a couple of things that we're going to announce today to try to help. So we talked throughout the pandemic about the National Guard. They've been there to answer the call in so many ways, from vaccine clinics to other COVID response. They've helped at our food pantries and staffed our medical facilities, making sure that Kentuckians are safe and healthy. Last week, we also got the word, thank goodness, that federal approval to continue supporting our pandemic response through the Guard is going to continue at least through the end of this calendar year. In Kentucky, this means our guardsmen and women will continue to suit up to help us fight the deadliest enemy, certainly in my lifetime. Current plans are we are going to initiate an operation on September the 1st. That's how long it takes to get people up and running, of dedicated National Guard, including a central command for our mission to help our hospitals. There'll be deployments in 2-week increments. The initial deployment will be 75 National Guard men and women. There'll be 5 teams of 15. Each will have 2 to 3 leads who will run an on-site operation. Our locations to start will be St. Clair Regional Medical Center in Moorhead. I hope while this won't fix things, it shows that we care and we want to help y'all if you're still watching. If you're not, I know you're helping people. Med Center Bowling Green are going to have 2 to 3 teams. Pikeville Regional Hospital, 1 to 2 teams. Teams will arrive 1 to 2 days early to get assignments, coordinate with the hospital, and state liaisons. Other missions into the fall include mobile vaccination teams, supporting local health departments, and continued food bank support. Our National Guard has answered the call each time during this pandemic. We appreciate them. We are going to continue to work with them to provide support. But I want folks to know that a whole lot of what we're going to be able to do is additional hospital support. Most National Guard who are doctors or nurses are currently in one of these hospitals. And we're going to do our best to make sure that we're not taking resources from a hospital that is already struggling and just moving it. So a lot of what we're going to be able to do is the other support throughout the hospital, freeing people up to provide more of those services. So again, we know healthcare workers are tired, overworked, and under great stress. Our hospital systems are reaching capacity while patient needs continue to rise exponentially. In other surges, we have always made sure our healthcare systems have not been overrun. It's looking more and more likely that that's going to happen with this Delta variant, especially because the available pool of licensed healthcare providers has decreased due to attrition and just the incredible demand that's been placed on them. That's why we have submitted a resource request to the Federal Emergency Management Agency, FEMA, for additional healthcare professionals to help where we need them the most. We've requested 8 teams. Each team would include 8 registered nurses, 2 certified nursing assistants. We've also requested 2 EMS strike teams that would be able to transfer patients from a hospital that is full or doesn't have the level of care to another facility. Right now, our EMS is so strained, they're worried about doing regular emergency calls. We're looking at having some more help for them in just a second. If we get federal approval, the medical teams would support St. Clair, Pikeville Medical Center, St. Joe's London, Medical Center of Bowling Green, and Baptist Health Hardin, just as a start, some areas that have been hit hardest. We have also, through a program called K-Beams, requested 3 additional teams of 5 ambulances apiece. This would help all of our local EMS and counties do regular emergency runs that either people can't do because of COVID or they're just so strained because of the extra COVID runs. We hope FEMA will approve this request quickly, but I do want to say we're not the only state going through this, and there are some states that right now are hit even harder than we are. So we'll await word. It was our job to ask and to push as hard as we can, and we hope we can get as much help as we can. So that leads us to what this week is. This week is about making sure that we don't lose any more doctors, nurses, custodians, local healthcare professionals during this pandemic, that we can help provide them the strength and the resiliency, the support, the encouragement that they need with dealing with this wave, because you hear it from them. They're exhausted They've been through trauma, and they're frustrated because we're about to endure, and we're already enduring great difficulty. We're going to see a lot of loss of life, and all of it's preventable, which I know frustrates all of us. But imagine the person that's holding that individual's hand, knowing they would otherwise still be here. So this week, we've declared as Healthcare Heroes Week in the Commonwealth. And today we're going to sign the proclamation that makes it official. But folks, this proclamation is just a piece of paper. And it's one that I hope our healthcare heroes will be excited about. It might give them a little bit of second wind, but it's what you do. It's all the things that you're willing to do organically in your community, whether it's providing food, whether it's calling somebody that you know that's on the front lines and just telling them thank you. Anything that you can do to lift up these folks. I mean, they've been fighting a war for 18 months. They see the devastation that we don't, because people with COVID are either in their homes or in the hospital. Everything we're taking for granted that we can do right now, they have been a huge part of ensuring that we can. So we need your help. Spend part of this week thanking those around you. I was able to go to the Franklin County Health Department group that's helped take care of us here in Frankfort, a group that, along with others, now has Frankfort as the number 2 county for vaccination at 71% of all of the residents. I took them donuts from Poppy's, a place right here in Frankfort. And we also took a sign. I know it's small, but just to say we love and we care about you. Folks, small things go a long way. These folks are doing the testing right now, seeing firsthand as this is increasing. And remember, so many of these folks and others have also had to deal with spray painting of their building, threats, bullying. Let's lift them up. Let's do everything we can this week to make sure that people truly know how much we care about them and how grateful we are. So we have one more video today. It is from Mercy Health Kentucky in Paducah. It's President Michael Youngman, who has a message certainly for his healthcare heroes and others across the state.
Like the governor, I agree there's one thing we can't do enough of during these times, and that is to thank our caregivers for all they're doing to care for the men, women, and children in our communities. I'm in awe daily of the truly heroic work of our nurses, doctors, and care teams to care not just for patients, but for each other, especially as we see the number of COVID-19 cases rise again in far western Kentucky. Despite being tired and having given so much already, they never fail to rise to the challenge each and every hour of each and every shift. They give compassionate, expert care to patients who are sick, scared, and often unable to see their families as they fight to recuperate from this frightening illness. Many members of our care team have chosen to be vaccinated to further protect themselves, their families, and their home communities. And for that, I'm also grateful. I particularly want to give a shout out to my colleagues, my friends at Mercy Health Lourdes Hospital and Markham and Wallace Hospital. You are Team Kentucky.
So again, do everything you can this week. These are folks we desperately need to have the energy for that next person who comes in to get help. That could be one of our family members. All right, like we said, 119 out of Kentucky's 120 counties are in the red zone as of today. I think only Robertson is not. We have an updated set of red zone reduction recommendations that we're going to be asking local leadership to follow, to implement, to do everything you can. Number one is when you're in the red zone, number one thing you can do to get out of it is get people vaccinated. Heard about a big effort going on in Clay County right now. It's exciting. A number of people have come together and are going to be working really hard, and look forward to seeing those results. But once you hit the red zone, that's what we need to think about doing. Who can push your vaccinations? How about every coach? How about every local leader? How about the business leaders in the town? Whoever, wherever, everything that you can do. And listen, if you got people that want to get vaccinated, there are places all over your community that would be delighted to give them that vaccination. Second is we ought to be in red zones requiring masking in government buildings. If we can't walk the walk, people don't believe our talk. That's what we do here in the Capitol. Franklin County is in the red zone, but listen, I care about my workforce, and I know masks work to protect them. We need to be encouraging masking in public indoor settings. We need to be encouraging masking in crowded outdoor settings. As much distance as you can, use outdoor spaces as much as possible. Consider limiting events. Encourage medically vulnerable people to avoid large crowds, and engage community partners to implement a strong communication plan. Let me talk about just one of those. James, do we have the study on masking from North Carolina and Georgia Tech? Today, a study came out. We'd had a couple of bullet points on it. It was specifically related to modeling that they had done in schools that went through the CDC. Specifically, it said that an unvaccinated classroom, can you go to the bullet point piece? And I think we had a couple of edits on that. Keep going. Keep going. Okay. They'd said that the expectation should be in the course of a semester, 90% of a class, of a school, ultimately of a system should expect to be quarantined without the use of masks. They also said that masks, universal masks in schools could cut transmission 80%. We'll get you that study. We'll go over it on Thursday because it's that important, but that's specific data about how masking can protect us. Masking will protect you that much in a government building. Masking will protect you that much in a retail establishment. Masking will protect you that much in a grocery store. It works, and it's the key, along with vaccines, to keeping everything open. Look at that West Texas town. Now, government's not going to shut anything down. We're not going to, but COVID will. So the question is, if you want everything open, are you willing to do what it takes? And now, at least one excuse to not get vaccinated is gone, because the FDA granted full approval to the Pfizer vaccine. It announced today it has done its full, thorough, and independent scientific review of the Pfizer vaccine. They've been looking at clinical trial data and safety efficacy for almost a year under their normal process that okayed every other vaccine. It is a key milestone. This is the gold standard. So anyone worried that it hadn't been studied enough, this is full approval. This is the maximum they do on anything else that's approved. And folks, 200 million Americans have already taken it. If it caused significant problems, if it caused anything, we would know about it. You would know about it. You'd be able to see it. So please, about half of this country, more, has gotten it. It's time. It's safe. It's effective. And the Pfizer vaccine is fully FDA approved. And if you need another reason, you can win $1 million. Our last shot at $1 million drawing is this Thursday. So you need to get registered. If you haven't been vaccinated, you need to get your first shot before Wednesday evening. In fact, before Wednesday evening at midnight, you got to get that shot and you got to go online. We've had almost 100,000 new entries since our last drawing, and I hope even more people will get vaccinated in the next 2 days. More than 850,000 Kentuckians 18 and older have entered to win the $1 million. Nearly 50,000 youth ages 12 to 17 have entered to win that full scholarship. We're going to get 5 more of them out. That announcement will be on Friday, the drawing on Thursday. Please, please get your fully FDA approved Pfizer vaccine in the next 2 days and try to win $1 million. So a lot of bad news today, a little bit of good news. Last 3 days, we've had a lot of vaccinations, 31,847 between Saturday, Sunday, and today's report. Woodford County still leading the way in our top counties at 72%. 2,476,420 Kentuckians now vaccinated. Let's go through the demographics and the geography like we normally do. So we're now 2,476,420 vaccinated. We're up 1% on our total number of adults. We're still showing this as opposed to 12 and up because the census that we have relied upon, as opposed to this newest one, which we can transition to, didn't have the other age groups, didn't break it down starting at 12. So this is up 1. 65 years and up went up 1. I'm so excited about this because while 84% was great, we've been stuck at it a long time. And those at that time, 16%, now the remaining 15% here is still highly, highly, highly vulnerable to the Delta variant. So very excited to see this. 50 to 64, increased a percentage, got to 70. We're excited about that. Need to keep going. Remember those ages that I read today. This is really hitting 30 to 60. Ages 40 to 49, up a percentage to 57. 30 to 39, up a percentage to 52%. 18 to 29, this one's good to see, up a percentage, but still. That means that 59% of all Kentuckians 18 to 29 have not gotten the vaccine. And again, we will have a transition at some point to the new census numbers. That's going to throw all the percentages, right? Once you change the denominator, it's going to change all the percentages. But at that point, we'll be able to get the 12 to 17. So that's demographic. Let's look at counties. The first time in at least 2 weeks, we have added a couple counties that now have over 50% of their population vaccinated. That's Hardin and Perry County. Thank you. Keep it up. 50% obviously isn't nearly enough, but that is a threshold that so many counties have not passed. Counties with more than 40% of their population vaccinated. Folks, if you haven't made this list, it is more likely than not that every person you run into will not be vaccinated. That ought to be terrifying in the midst of the Delta variant. But we had a number of counties join above 40%: Greenup, Carter, Johnson, Butler, Leslie, and Pulaski. Again, please keep it up. We want to see those numbers continue to grow. And let me look through my notes, but I know that is a lot. Yep. That is all that we have, the specific updates on today. But I know that there's going to be a number of questions because we got a ton of journalists here or online with us. We'll start here with Drew Gardner.
Governor, following the Supreme Court ruling over the weekend, you rescinded the mask mandate. Senator Stivers has already said that he's had preliminary discussions with your office about a possible special session. Have you worked out any plans as far as how you're going to work with the legislature on pandemic response going forward?
So we've had multiple calls and a meeting today with calls with leadership from both chambers, meeting today with the Senate. Here's what the Supreme Court decision changes when it goes into effect, which will happen sometime in the next 20 days, just the way the timing works. You know, up to now, I've carried the football. I've been able to make the tough, unpopular decisions. And trust me, I've seen some of the protesters that show up when I believe I did the right thing, but it's still the hard thing. And, you know, rarely is doing the right thing the easy thing. The policy decisions now, though, behind that, the Supreme Court has said have to be made by the legislature. So I'm going to continue to use any tools that I either have at my disposal from other laws. I'm going to continue to use the National Guard like we can, request help from FEMA, continue to work with the federal government on their end. What'll change is the scope of the decisions that I can make or what we can do is going to be more limited depending on what the legislature decides. For instance, I believe that we are reaching the point where a statewide mask mandate is absolutely necessary because we got to have hospital beds. I have an aunt that is still in the hospital after a really bad fall and some emergency surgery. Bed wasn't available to her. She wouldn't be with us right now. But our talks have been constructive. It has been a good dialogue. I certainly hope that they will, again, make the very best and sometimes courageous decisions that are necessary. I'm going to try to provide the data and the information to help people make those decisions. Chad Hedrick.
Going right back on talking about that mask mandate. Obviously, I'm sure you're aware that would not be a popular call amongst several Kentuckians and even lawmakers. Do you have the confidence, based on your conversations today, that the legislators would approve the mask mandate?
I don't know. They, to be fair, they haven't been in this position before, making this call, and they're going to want different sets of data and to see different things. I think we do a good job of providing data to the general public that include legislators, but now we need to fill all the specific requests they have, and they deserve the time to come to that evaluation, to talk to our experts, to talk to others if they want. But I think it remains to be seen. I think there are some kind of no-brainers that hopefully everybody will agree to. Right now, the EO that I did on recognizing out-of-state doctors and nurses so they can help with our hospital crunch, that'll expire when the state of emergency expires. So I think in the very least, we can hopefully come to agreement on some basic tools that we're using to fight this, and then maybe it'll take deeper conversation for the others. Tom.
Governor, are there things that you can do through the administrative regulations, like the school mask mandates, that are still valid? I believe they're still valid.
Well, I believe the Kentucky Department of Education's EREG is still valid, and I think that the Supreme Court decision talked about those things. But listen, as we move forward, this has got to be a process where I can't make a lot of those calls anymore. I'm willing to, no matter what it pretends to my future, because I've already had to, but because I just got committed early on that I wanted to make sure I did what was right throughout the entirety of this. It's a heavy responsibility, but what I've seen in the last couple of days is it's being taken seriously, and I hope good decisions will be made, and I'll do my part to try to help, and then effectively carry out what we're given the authority to do. I mean, remember that those will be decisions on what the executive branch can and can't do, but then we got to go do it. Catherine.
Do you believe this FDA approval will have a noticeable impact on the amount of Kentuckians that choose to get vaccinated? And should more businesses and events be requiring vaccination?
So I believe that the FDA full approval, as opposed to emergency approval of the Pfizer vaccine, will lead to a number of especially national companies mandating vaccinations. I mean, we've heard dozens of them that were just waiting for this point. And so I think we will see increased vaccinations because of that. Do I believe that it will lead to more Kentuckians choosing to get vaccinated? Some. I think when we look at those that aren't vaccinated yet, we got two groups. We got those that are still concerned probably about a couple of issues. One, hasn't been studied enough. If that's the major issue, then yes, it's time to choose to get vaccinated. Another is the myth that it'll make you sterile. It doesn't. There are 200 million people have been vaccinated. You can see that it hasn't impacted them when we look at other rates going on in the country, that it can impact your pregnancy. We've learned that now that you're much safer to get vaccinated while pregnant than not to, because if you get COVID while pregnant, you're at much greater risk than someone who is not. So that population, yes, I think it can help on. There's just a group, and we don't know how big it is, that is fully politically opposed to vaccinations for whatever reason, and it doesn't look like science is gonna help there. I think for them, it's someone that they love and care about, willing to have that conversation that could end their friendship. That could lead to people not talking for a while. But right now, it's that scary. I mean, I'd care a lot more about a friend or a relative that hadn't been vaccinated being alive next year than whether they're willing to talk to me. And I truly believe that the stage that we are at, that's the most effective thing that people can do right now. And if they don't, I'm not sure there's any other way to reach certain folks. And that's not me trying to belittle those that are in that politically opposed group. I just really want them to be healthy and to still be here. And I think that's the best way to reach them now. All right, we got a bunch of journalists on virtually. Let's start with Josh James from WUKY.
Hi, Governor. Refrigerator trucks were mentioned by one of your speakers. Can you speak to whether or not, or to what extent, any hospitals are needing more trucks at this point?
I believe, based on what I have seen, that 2 hospitals in Kentucky have requested those trucks. Now, we did hear that Ephraim Mcdowell, has a morgue that fits 2 to 3, but that also shows you how rarely people die in that facility, and having 7 over that period of days, is really concerning, and for that community ought to be a compelling reason to go out and to get vaccinated. I hope that we don't have to see this in more of our communities, but we are seeing more COVID patients and serious illness in hospitals in areas that are less vaccinated than before. Sometimes those numbers are doubled right now, where they might not be in other areas of the state. And so that puts a lot of pressure on hospitals that aren't normally used to of care. Alex Akisto from the Herald Leader.
Hi, Governor. 2 quick questions. One, you mentioned that you had asked in the meetings earlier today and over the weekend about reinstituting mask mandates. Is that something that you have explicitly asked lawmakers to reinstitute? And secondly, you mentioned the FEMA and National Guard requests that you've made. The FEMA, I think you said it was 8 teams with 8 registered nurses, 2 certified nursing assistants. What other options do you have at your disposal to request more resources beyond that? Thanks.
So first, let me say that I'm not going to talk about the specifics of the conversations with legislators, because I think they and we deserve candid conversations and passing of information. But no, while I have said publicly, and 2 individuals that I think it may be necessary, I have not made a specific ask there, and it's not right to make that before everybody gets to see the numbers. So there hadn't been any decision on their side, because it hadn't been in front of them, and this decision just came down on Saturday. What was the second part of the question? Oh, other options for staffing. This is a real challenge. Certainly, it was recognition of doctors and nurses from other states. We have some contracts in place where you can work with staffing agencies. The challenge is none of them can find people because they're all in other states. Other challenge, when we are able to bring them in, you got to pay a lot for it, but you got to have the people. So if you can get the people, you do it. And then they show up at a facility, and those that have been there for 18 months that make less than these people are getting paid, are rightfully frustrated. And then we have people that have been working regularly in 18 months leave and join the staffing agency and maybe walk into the same hospital. And there isn't really a good solution for that, because you got to do everything you can to get that extra staff. But the other avenues right now, every other state is trying, and severely difficult. So we can recognize folks from other states, National Guard, FEMA, and then assistance through contracts from staffing agencies. Sarah Ladd, Courier-Journal.
Yeah, thank you. Will you be requiring vaccinations for state workers now that Pfizer is approved? Thank you.
Yeah, I think that anything having to do with mandates on vaccines would now have to be decided by the state legislature. I think that's a really big policy decision, and that's now in their court. Haven't talked about it at all. and want to figure out what gets us there in the best way. Got certain populations in the state where we need increased vaccinations, corrections officers, those working in our state long-term care. But I'm not at a point of recommending a blanket mandate. I do think we have to continue to look at incentives, and we also have to continue to look at our state costs. If you think about our state health plan, if someone gets vaccinated, it costs $0. And if that keeps them from going to the hospital, that costs us $0. If someone does not get vaccinated and goes to the hospital with COVID, it costs us tens of thousands of dollars. So we as a state are experiencing significant costs through our health plan, and others are too, for those that refuse to get vaccinated and then need care, especially those that need significant care. Stu Johnson, WEKU.
Thank you, Governor. Good afternoon. You talked about the talks that you've had thus far with the GOP leaders in the legislature and being productive at this point. Can you foresee a situation where COVID-related policies could be enacted without a special legislative session?
I think at this point we would need a special session because the state of emergency would expire without one. Now, it could be very limited. It could be extremely short. But once that state of emergency expires, things like prescription refills, added flexibility, workers' compensation for our frontline workers, and some other pieces like that, expanded SNAP benefits that have helped people to get through that, recognition of doctors and nurses in other states. So the state of emergency is necessary for those, and in my mind, is the key to at least have some belt and suspender tools that we need to fight COVID. So I don't foresee that. I foresee the legislature needing to make a lot of the calls from here forward under the Supreme Court decision. I will say I was surprised by the decision. You know, there was page upon page in the previous opinion talking about potential constitutional powers, and I think at least part of the court had a change of heart. But it is what it is, right? I mean, when they rule, that's the law. Do I think it'll have some ramifications? Yes. But at the end of the day, once that comes out, you got to follow it. James Pilcher from WKRC. Oh, okay. Well, he also sent me a bunch of written questions, so he's trying to get away with both the virtual and the written. So I'll hit his written questions. Zach Gerard from the Kentucky Colonel.
Hi. Thank you. You mentioned that you had talks going about possible mask mandates. When would you estimate that a result, whether it's mandates or not mandates, would come out of those talks?
So we've had general talks, and our talks have primarily been on some stuff we'd hope to find agreement on. So we have not had a direct discussion of mask mandates. I haven't gotten any feedback on that yet. I haven't asked for it yet either. So I want to be real clear on that. I don't want these talks to go off the rails before we can try to get them moving in the right direction. But yeah, we're reaching a stage with hospitals bursting at the seams. And listen, it may be something that they disagree on, and a statewide mask mandate for people indoors is now ultimately their call, and they can look at all the information and make the best decision that they can. If it was still in my authority, we'd really have to look over the next 2 weeks, and if we continue to see the acceleration in hospitalizations, you know, I would make the decision to do it, because we can't run out of beds. We cannot run out of staffed hospital beds. The results are disastrous there, because then we start losing people to heart attacks and strokes and car wrecks. And you heard some of that today. But I've also been looking at this data for a whole lot longer than others. So let's try to provide at least a little bit of time for everybody to be able to in those caucuses to discuss it and to see where they want to go. Melissa Patrick, Kentucky Health News.
Hi, Governor. Are you getting any reports of equipment shortages in the state's hospitals? We know of one that was without high flow nasal cannulas for a few hours last week and had to use a different type of equipment, to take care of their patients. Are you getting any word of that?
We have gotten just a little bit from one hospital here or there. I think that some of the monoclonal antibodies or what's required to do some of those transfusions, because it is something that we're trying to do more of, especially for sick patients, that there's some worries in how much we're doing them, and we're doing them in places that they normally don't do them, or trying to do them in places that wouldn't normally do transfusions, that we have some concern there. We are now starting to hear, and this question was asked of me, I think last week, of some concern about getting testing supplies. But on the good end, right now, we're not hearing of any PPE concerns. So, just sporadic concerns about hospital equipment or specialty staffing, uniform concern about overall hospital staffing, and then some new concern about testing supplies. Yasmin, and correct me, please, Yasmin, if I miss your last name, Juma from WFPL.
Hi, Governor. It's Yasmin Jaman. But yes, will you be calling lawmakers back for a special session to address the uptick in cases?
Well, thank you, Yasmin, and my apologies. It all depends on if we can get to a place where it's productive. Certainly, I think that the state of emergency needs to continue for a number of non-controversial reasons. And my hope is at the very least, we could do a special session that be authorized, and whatever limitations that the legislature wants to put on it, or requirements. Okay, in the end now, that's their call. I'll advocate for as much as I can that I think is necessary to keep people healthy and safe, but without a special session, at least from what I'm seeing right now, that state of emergency will expire, and that has some ramifications. I think anybody who recognizes the pandemic is real, want to avoid, and I think even Kentuckians that don't like just about any of it, which I think is a very small portion, would agree that some of these things are things that we need. I mean, enough doctors, enough nurses, the ability for elderly Kentuckians at risk to get prescriptions refilled, workers' comp for EMTs that come down with COVID or are quarantined. Just so I would expect that we will probably need one in the future. Again, if we can come to agreement. I don't want to do it just to do it. I don't want to do it just to pass the football and say good luck. I want to try to do it in a way that gives us the best opportunity and gives them the best opportunity for success. I always said this wasn't about me, it's about life and death. So I'll do the very best in the slightly new role to try to give everybody the best chance to do that. Kimberly Keegi from WSAZ. Okay, someone from WDRB. Darby Bean from WDRB.
Thank you. Yes, thank you. My question for you is that you had just said you were surprised by the court's decision and mentioned that you believe there could be ramifications for that. Can you be a little more specific in what you mean as far as ramifications that could potentially come from that decision?
Yeah, I just have concerns about how we respond to emergencies. I believe that a centralized management of emergencies is critically important, and any emergency management structure that you set up is set up that way. Admittedly, I also think it's harder on a bigger body to make difficult, controversial decisions if it's the right thing to do. But the decision's the decision, right? That's the law. The position that we put forth, I still think is right, but we lost. I lost. And so I'm going to do the very best I can in the framework that's been provided. I can still work my tail off every day with the tools that I have to protect people the very best that I can. All right, Olivia Krauth, why did I rescind the mask mandate for schools today? Because of the Supreme Court opinion. That mandate we were able to do based on what we believed was constitutional authority based on the last Supreme Court case. This one came out, it was different, and so we thought that was a step that needed to be taken. It was also something that I think that the legislative leadership, at least initially, has been opposed to, and hopefully it was a good step to try to be able to take some time and have some conversations and hopefully come to the best place that we can about moving forward. Okay. James Pilcher is asking about the Brent Spence Bridge, comments that I've made about surplus and rainy day funds being used for the bridge. Listen, there are a lot of ways to skin a cat. For instance, a large part of KSP's budget comes out of the road fund. We can certainly pay extra portions of KSP's budget from the general fund when we had the largest surplus ever and have $2 billion in the rainy day fund and free up additional transportation cabinet funds to put into that bridge. With this transportation bill going through Congress, if it passes, I truly believe that we're finally going to get that project done and in a way that doesn't burden those in Northern Kentucky. All right, folks, today's was tough, tough for a number of reasons, but it's really dire out there. It's really dangerous. You know, I spent this weekend with my family, specifically part of a day with my son. Not enough masks being worn out there. This is your health. And remember, if you've been vaccinated, you can still spread it. So please, please get vaccinated, put on a mask, do the right thing. This is a very scary time, and be careful in everything else, right? This could be the worst time in my life to be in a car accident or to have other health problems. So take care of yourself. We'll get through this. It's going to be a tough couple of months, but we'll get through it together. Thank you.